part of the Perfect Comfort series, in this episode I'll be demonstrating how you can incorporate some simple prehabilitation techniques into your horse's grooming session, which will help you to keep your horse comfortable on a regular basis. Time constraints are always an issue for the busy horse owner, as there are so many tasks associated with caring for a horse. The daily grooming session can provide the perfect opportunity to focus on your horse's well-being without distraction, so as not just to make your horse more presentable aesthetically, but to apply a series of prehabilitation techniques to help maintain your horse's comfort. The advantage of evaluating your horse during grooming is that this normally takes place before the ridden session, so you can then modify the exercise session if need be. With just a few extra minutes added to your daily routine and with practice, you may find that you can detect early signs of discomfort or restrictions and potentially intervene to resolve any issues in the early stages. You can amend the routine to incorporate a simple assessment on a daily basis, then carry out a more comprehensive routine on a weekly basis in place of the ridden session to allow yourself more time. You might also evaluate your horse more thoroughly, for example, before and after a competition, or if your horse is being turned out with some boisterous new friends. You will also be able to use these techniques as a reference point to monitor any changes, as they have been formulated to provide you with useful information about your horse's daily well-being, although not as a substitute for consulting with your vet if you have any concerns about your findings. Before you start, stand back and have a really good look at your horse. Do they look well? Is the posture strong and balanced? Are they shifting weight? Is the head carriage normal? Do they look relaxed yet alert and ready for work? Does any region look tight or mildly contracted? Familiarise yourself with looking at your horse all over, even if you may not quite know what you are looking for to begin with, so that at least you may feel when something is not quite right. Then turn your attention to your horse's breathing pattern. 8 to 12 breaths per minute is the norm in a relaxed horse. Note how deep or how shallow the breathing is. Take a look at the gums. They should be pale pink or salmon in appearance. Assess capillary return by gently compressing an area next to the teeth and evaluating capillary refill, which should be no more than 2 seconds in the healthy horse. In my experience, few horse owners trot their horses up regularly. Pair up with another horse owner for this and trot up for each other if you are confident that you can handle each other's horses. First, walk the horse up and back, observing from in front, behind and the side. How forward going is the horse? How fluent are the steps? Is the movement transmitted fluently through the spine? Is the head carriage relaxed and following the movement? Listen to the footfall. Is it perfectly foretime? Is the horse landing more heavily on a limb? Are the shoes secure? In trot from in front, establish which limb is landing and call it out before looking at the levelness of the head for lameness. Left, left, left. You will then find it much easier to establish which is the lame limb, rather than seeing a head nod, then looking away to establish which limb is unsound. Hind limb lameness is more difficult for the untrained eye to assess, so start by looking for a generalised symmetry or asymmetry in the musculature or movement pattern at the level of the hips. Look for defects in the gait. If, for example, you find that one limb is travelling further or adducting towards the midline or is abducting away from the midline, or any of the limb joints appear to sway on contact with the ground, or foot placement and or flight arc is abnormal at shoe level, make a note of this in case you need to consult your vet. Next, have the horse turned on a tight circle, forward and fluently around, but only flex your horse to a circle that they are comfortable with. Older horses usually require a bigger circle with only 1 or 2 repetitions compared with younger horses. The horse should move fluently, conforming to the flexion, stepping across and under behind without an obvious hip hike on the outside hind, and the head, neck and spine should curve gently to the inside without hesitation or resistance. Do this in both directions, repeating the direction that the horse was initially turned in case they were unsure of what was originally required of them. If you have any suspicions about your horse's soundness that you want to assess further, it can be very useful to walk and halt them 5 or 6 times after proceeding for a couple of strides, then observing the limb position each time they halt. Make sure they are able to halt with minimal restriction from the handler. If the horse avoids loading the same limb each time and has formed a pattern of halting in a particular stance, this can indicate guarding against fully weight-bearing and uncomfortable limb. Or perhaps there may be a region or tight muscle that the horse may be feeling higher up the limb. Relate your findings to any other clues about gait issues that your horse may have. If you are having any body work or therapy done on your horse, this can be a very simple test to see how much change has been achieved in the posture, and if your horse reverts, you may find that this is a sign to have your horse checked again. Before lifting each foot for picking out, run your hand down each of the lower limbs to check for any signs of heat or abnormalities, and pick the foot up when you get to the hoof. After picking the foot out, flex the pastern and fetlock joints very gently, noting any signs of discomfort, snatching away or guarding from your horse. Take the sole gently towards the elbow and flex slowly from side to side to assess the knee or carpal joint. Extend or protract the elbow and carpal joint, then retract the elbow and abduct it. Take these joints no further than the horse is completely comfortable with. As a horse owner, you are looking for signs of any mild reactions in your horse as the joints are moved through or towards their normal range of motion, not to actually perform clinical tests while the horse is not warmed up. So be careful not to take the joint any further than your horse should normally be comfortable with, comparing your results with the opposite limb. The hind limbs are naturally more restricted than the forelimbs because of the reciprocal apparatus, so take care in case the horse objects to having its hinds flexed, extended and abducted. Only do this if the horse is compliant and it is advisable to wear a hard hat. This can take much practice, and it can be enough to simply observe your horse's reactions to being asked to offer a hind for lifting. Extend the toe towards the ground, comparing results with the other side. Note that the limb being lifted may not be the problem, that it could be that the horse is reluctant to have more weight loaded onto the other limb. Also note that a safe surface is used for this. While you are working on the hinds, assess the lumbosacral region, that is, the area where the flexible spine meets the inflexible pelvis, a very vulnerable region for the performance horse. It is therefore useful to assess how your horse reacts to gentle mobilization of the last lumbar joints and potentially the sacroiliac joint. Do not do this if your horse has any existing hind limb joint problems, and again the horse must be on a suitable surface. Lift the hind limb upwards in one movement and observe dorsiflexion of the lumbar on the same side. Movement should be smooth and effortless. Compare one side with the other. In my experience, a unilateral fixation of that joint will result in a very noticeable restriction on one side that the inexperienced handler finds almost impossible to lift against. If you have any concerns about your results, you should consult your vet. As you now begin the brushing phase of your grooming session, start in the neck region and alternate brushing with palpation or feeling of the muscles. Let your hands gently conform to the individual muscles and compress them moderately, assessing the tone as you progress. At the base of the neck there may be a series of localized stress points in the origins of the serratus cervicus muscle, which elevates the base of the neck, and the opposing brachiocephalicus muscle, which flexes the head and neck and assists with protracting the forelimb. These stress points can develop from eating from hay nets, travelling, or riding on a contact which the horse resists, for example. They can vary from mild and barely palpable to acute and reactive. If you massage the area to warm and increase circulation, then hold the reactive area with the top of your thumb or finger for up to a minute, you should feel it improve. Return to effleurage massage to finish. Repeat at the pole region where a stress point can be found in the region of the second cervical vertebra. Next, gently assess lateral flexion of the neck by standing beside your horse and gently encouraging him to slowly fold his neck around you by moving his head to the side. Most horses will not object to this. Repeat on the other side, noting which side has any resistance. Moving on to the shoulder region, another common stress point is the origin of the long head of the triceps muscle, right in behind the middle of the caudal border of the scapula, or in other words, immediately behind the shoulder blade, where the latissimus dorsi muscle runs under the scapular region to the humerus. This stress point is usually deeper than those found on the base of the neck because the region is generally much more congested. Repeat the same procedure for resolving the tension at the base of the neck. Effleurage for about 30 seconds, then applying sustained compression to the reactive point for up to a minute, then repeating the effleurage strokes. You can protect your fingers by covering one finger with another. Next, palpate the withers for a reaction to the musculo-tendinous junctions of the trapezius muscle. Standing on the opposite side, run your middle finger close to the tops of the dorsal spinous processes, and you will feel a mild contraction as you pass over a spasm. Hold the middle finger on that spasm, pull towards you slowly to create a little more stretch on the muscle, then pull quickly towards you. Keep the contact and continue along to where the withers end and the mid-back begins. This technique is a move formulated by my good friend Daniel Kamen, American chiropractor and author of The Well-Adjusted Horse. You can find more information on his website, animalchiropractic.com, where you will find links to his demonstration videos. Next, after you've brushed the mid-back and lumbar region, from above waist height, feel along beside the spine, beginning with light compression and then progressively deeper. Make 3 firm sweeps, progressively further away from the spine, down as far as the top of the rib joints. Again, note any reactions or palpable muscle spasms under your fingers, and for the mid-back, any tension can be treated as shown for stress points, with effleurage, compression, and repeating the effleurage. There is a common stress point against the last rib close to the rib joint, which in my experience can form a substantial reactive adhesion of the overlying fascia. Take care when palpating here, as the horse can be very sensitive in much the way as if you were being touched firmly in the rib cage yourself. You may need to apply heat to soothe the area, or keep performing effleurage until the region is heated thoroughly before you attempt to compress it. Again, to help resolve the tension, the process is effleurage, compression, then effleurage. Returning to the lumbar and gluteal regions, palpate about 2 inches or 4 centimeters from the spine, getting progressively moderately deeper. You may be able to locate spasms which cause your horse to react by flexing suddenly. Another of Daniel Kamen's techniques is to apply a fast compression with your elbow to relax the tension. Place your elbow into the spasm, compress slowly until you get a reaction, then press faster to complete the move. Test your horse's reaction by first doing this only very gently. It is the speed which will bring about the relaxation of the muscle, not the force of the compression. You may need to repeat it a couple of times, then recheck it a day or 2 later when the horse has had an opportunity to mobilize the region fully on its own. When you have done this, you can mobilize the entire back by scratching moderately deeply just above the tuber coxa and diagonally just behind the scapula, approximately where the points of the saddle tree lie. The spine should form a slight S-shaped curve from the withers to the pelvis, and this curve should be the same for both sides, although commonly it can be restricted on one side. It is a very good suppling exercise when performed 5 to 10 times before and after riding as a dynamic stretch. Next, palpate the hamstrings for excess tension. They should feel spongy or rubbery rather than tense and short. Progress across the ribs and onto the girth and pectoral regions, assessing for general sensitivity which can occur if you tend to over-tighten your girth. A sheepskin or neoprene style protective cover can help in those circumstances. Next, evaluate the tail for tension or restriction by gently moving it through its full range of motion. Also check further down the tail for tension, which can develop due to travelling in a confined area. While in the tail region, if you fully trust your horse to be compliant with this without kicking, stand to the side and scratch about a hand's width from the tail, gently at first so as not to alarm your horse into acute dorsiflexion. This is another exercise you can use to supple and strengthen the back, in conjunction with the other panniculus reflex induced by scratching just behind the scapula and above the tuber coxa, which I demonstrated a few moments ago. Your horse should lift the back smoothly and fluently and be able to hold it for at least 10 seconds. A second attempt may induce a guarding response with the horse not lifting at all if any discomfort is likely to be caused. Your horse will absolutely love being massaged during the grooming session. A ball bearing style massager will reduce fatigue to your arm because it slides easily across the horse's coat. See how Charlie is drifting off to sleep in the background, and I've only been using this for no more than 30 seconds. Alternate long sweeping strokes with a circular motion, and if you get high enough over the horse's back you can get deeper and reduce fatigue to your arm by applying more of your body weight behind the movement. Apply short, slow, deep pressure to the lumbar region to address any tension there, returning to the mid-back with a circular motion. Work along the gluteal tendons and muscles in the same moderately deep circular motion, and if your horse rests the leg on the same side that you are working on, you will know that they want you to continue. Many horses will move to a position which places their uncomfortable regions directly under your hand where you are working. Let them move around so that they get the opportunity to express what they need. The next technique requires a rubber massager or rubber curry comb to gently grip the skin. It will take you only a few minutes to promote circulation almost to the entire skin surface of the horse's body. Simply place the massager against the horse's skin, press in to grip the skin, then away and back again, moving the skin over the underlying muscle. Work across the muscle body rather than along it, as you would do for massage. You need only perform this skin tugging technique once over each area for a stimulating whole body massage. Starting at the atlas or pole region, work across the long neck muscles. Then down over the shoulder to the triceps, deltoid, and infra and supraspinatus muscles, and the trapezius muscle. Take care in the pectoral region because the horse is sensitive there and cannot see what you are doing or what tool you are using on them in that vulnerable area, so they may try to bite you. Know your basic anatomy of the superficial muscles so that you can apply the technique across the muscle belly of each muscle. Be thorough in the biceps region if you found tension in the triceps muscle, which is the reciprocal muscle to the triceps. Work down the leg muscles and return to give the pectoral muscles a good localized stretch. Work down the legs again if you found them to be particularly tight. Allowing the blood to infuse the area will warm and relax those muscles more before returning to them a second time, and this applies for other parts of the body too. Ease the pectoral muscles towards the front of the chest, again for a good localized stretch. Stimulating the masseter muscle of the jaw is usually greatly appreciated by the horse, which spends most of the day eating, using that muscle. Then work across the paravertebral muscles from the withers to the tail, that is, the top line muscles. Because the massager is rubber, it is fairly acceptable for your horse to be massaged over the skin, overlying bony areas. Return to the ribs to make another line along the body, taking care not to irritate the horse's sensitive areas. Then work down the quarters and continue to the hind limbs, including the hamstrings, which, because they are a large muscle group, may need 2 applications. Access the inner thighs if your horse is compliant. There is an area which is commonly tight and congested on the inner thigh, where the adductors insert on the tibia. Many horses are sensitive here and may kick, so keep yourself safe when working in this region. I've only worked one side of the horse, so you will need to complete the routine on the other side, either working one side at a time or one region at a time. To finish, return to the atlas and make one long, slow, deliberate and rhythmical line along the entire top line, from the atlas to the tail. At the end of the session, apply magnetic rugs, saddle pads, exercise sheets or neck covers, and allow your horse to rest quietly for a few minutes to recover if your grooming session has been intensive and they are relaxed. You may also carry out some pre-work stretches if appropriate to do so, now that your horse is prepared for them, following the series of concentrated localized stretches and warming of the tissue. I hope you've enjoyed this programme as much as I have enjoyed working with the wonderful Charlie. I'm sure that your horses will enjoy their grooming sessions even more now, and I hope that you will share your experiences with others and with me, either by email or on Facebook or by contributing to my blog. Look out for other titles in the Perfect Comfort range of videos which I'm currently working on, and good luck with making your horses supremely comfortable.